Chapter. My name is Kate Shamzad, and I thank you for joining us today. I'm a Senior Program Officer at the New Jersey Healthcare Quality Institute. The Quality Institute is a multi-stakeholder membership organization that convenes healthcare leaders in New Jersey around the common goal of improving the safety, quality of healthcare for everyone. Today, we're gathered together for a webinar entitled COVID-19 and the Flu, Vaccine Production, Access, and Adherence. As the COVID-19 public health crisis continues to test our strengths and highlight our weaknesses, the Quality Institute is continuing to have important conversations about today's toughest healthcare issues as they relate to our changing public health through webinars, quality briefings, and other valuable resources. We get through this together by working together, communicating our best practices with each other, and learning as our world continues to shift and change. Before we jump in, I just have a couple of housekeeping items. Please know that today our webinar is being recorded and a copy will be posted to our website later today. All phone lines have been muted for the duration of the program to limit background noise, so please continue to keep yourself on mute. And you may have a question that comes up, and you're welcome to type that into the chat box throughout the webinar. However, we do have reserved time at the end of the webinar for all those questions, so I'll be holding them until that time. Our intent today is not to provide clinical or legal advice. For today's topic presentation, COVID-19 and the flu, we're thinking about moving into an uncertain fall and winter, and our goal today really is to focus on the role of the flu vaccine in public health and in our communities. During this webinar, we'll discuss production and distribution of the flu vaccine, understanding the role of public health in flu vaccine campaigns and administration, creative ways that clinicians and health providers and systems are providing and approaching access administration in the time of COVID, and sharing strategies to make sure all individuals stay up to date on both immunizations and preventative care. Due to the pandemic, we know that vaccination rates have fallen for children and adults, and while office visits and immunizations for children have begun to increase again, this is not the case for adults, where we see dramatic declines in adult vaccinations, both in doctors' offices and in pharmacies. This is leaving many children and adults unprotected against vaccine-preventable diseases as we head into the fall. In this setting, we don't want to overwhelm our healthcare systems with adults suffering from vaccine-preventable diseases, particularly the flu, leading to what is being referred to as a twindemic. As we jump into today's discussion, I'm honored to have three expert panelists with us today, including two of our Quality Institute board members. Dr. Mary Campagnola is the medical director at Virtua Health, and Dr. Sharif El-Nahal, is president and CEO of University Hospital, and both serve as esteemed Quality Institute board members. From our Quality Institute member organization, GlaxoSmithKline, we are also welcoming Dr. Leonard Friedland, who serves as the vice president and director of scientific affairs and public health at GSK. Regrettably, our fourth panelist, Syra John, Vice President and Chief Pharmacy Officer from Horizon, is unable to join us due to unforeseen family events, but we thank her for her valuable insight that we used and her expertise that allowed us to prepare for this webinar. So without further ado, I'm going to jump into our interactions with our panelists today. And we'd like to take this a little bit differently than some of our webinars in the past, where we won't be sharing one particularly long presentation and a bunch of slides, but more of an open conversation with our doctors who are on the line with us today. As we jump in, I'd like all of our speakers to give a brief overview of who they are and what their role is within this topic, and also to help me debunk a few questions I've been getting lately in conversations with colleagues and friends and family. So I'll ask you a question, and then if you could just answer it and briefly introduce yourself. Dr. El-Nahal, one thing that's come up a lot is whether it's too early to get my flu shot right now. What do you think of that?
So it's not too early, and I want to thank the Healthcare Quality Institute for putting on this important session. It's timely, it's important from a public health standpoint, and it's more important than ever because of the times we're in particular with the COVID-19 pandemic interfacing with flu season. I'm Sharif El-Nahal. I'm privileged to be the president and CEO of University Hospital in Newark. Before that, I was a health commissioner for the state of New Jersey for the first 2 years of Governor Murphy's administration. So In short, no, it's not too early. And in fact, we are in the process now of vaccinating our healthcare workers at University Hospital, as are my colleague hospitals across the state. I've already gotten my flu vaccine last week, and there's this sense that it may be too early because the efficacy or the time that your immunity lasts may be a consideration for folks to delay. That really shouldn't be a consideration. We are in the middle of now a time where COVID-19 cases are actually already rising in New Jersey, and the risk of co-infection with both influenza and COVID-19 is real. And we're going to see some of those cases in the coming weeks or even sooner. And we can only hope that they are not going to be severe and lead to severe outcomes. And so to prevent you from facing that risk, it's very, very important to get the flu vaccine as early as possible, knowing that the flu has already started to circulate in our communities, as it tends to start in September. Of course, flu really does ramp up beginning later in the fall, much more so. And so, folks may have been more relaxed about getting the flu vaccine or have waited a certain period of time, which may have been okay or more okay, at least in the past. But it's really important to get that vaccine as soon as possible and proceed from there.
Thank you. So you heard it here. Time to schedule that vaccine. Dr. Campagnolo, how does the flu vaccine fit into, if my kids and I are not leaving the house, they have virtual school and I'm home working remotely, is there really a need for us to get the flu shot if we're not interacting with anyone? Please help us answer that question and then tell us a little bit more about yourself and your role.
So yes, you should get your vaccine, and so should your children. Everyone 6 months of age and older should get their flu vaccine as soon as possible. And again, following Dr. Elnahal's lead, I got my flu shot on Monday, and we're in the process of immunizing all of our coworkers at Virtua Health at this time, and our patients. So I'm Dr. Mary Campagnolo. I'm a family physician with added qualifications in geriatrics, and I've practiced in Burlington County for more than 30 years. I still see patients at the Virtua Primary Care of Mansfield office in Bordentown, and I also am the medical director for graduate medical education and our value-based or care coordination programs with a number of the insurers that participate with Virtua. So I am seeing patients directly and every day talking to them about getting their flu shots and getting other vaccines that are appropriate for their age. So thank you again for this program. I think it's a great topic to bring to the public.
Thank you. And finally, Dr. Friedland, if I'm not at high risk, do you think it's important that I should just wait to get the vaccine to make sure there's enough for those who are in a higher risk category? Can you help us answer that myth and then also share a little bit more about yourself?
Yeah, absolutely, Kate. That's a really important topic. And the answer is do not wait, even if you're not at high risk. The reason is that there's more than enough flu vaccine to vaccinate everybody in the United States this year. The Centers for Disease Control has a target to have close to 200 million people vaccinated this year, up from about 160 to 170 million last year. And all the vaccine manufacturers have worked to increase their supply to the US market, and we are on track. So there'll be plenty of flu vaccine for everybody 6 months of age and older who wishes to get vaccinated. So I'm Dr. Leonard Friedland. I'm a pediatrician in Philadelphia, and I am the Vice President of Scientific Affairs and Public Health at GSK. I also volunteer as a pediatrician, particularly with the Medical Reserve Corps here in Philadelphia. And in fact, this previous morning, I spent an hour going to 25 different retail shops in Philadelphia with information about flu vaccine, where the vaccine is available, what pharmacies, a QR code for customers to scan and find out where they can get vaccinated. So it's not too early. People of all backgrounds should get vaccinated and do it now. I got my flu vaccine yesterday.
Well, thank you all so much for helping us debunk some of those myths. I'm happy to say these weren't my questions and my family has fully been vaccinated now. But we're going to jump into a little bit more detail about both vaccines and preventative care. And we'll go round robin with our questions for you. And again, to those of you in attendance, if you have questions or thoughts that come up, please feel free to put those in the chat box, and that's something we'll be monitoring along the way. So Dr. Elnahal, we'll start with you. I know you were talking a little bit about how this flu season is going to feel a little bit different, but can you tell us a little bit more about what you're expecting this year as opposed to years past, and exactly what that duality might look like this fall and winter?
Of course. So one caveat before I approach this question is to emphasize that these are just projections. We have to approach this situation we're all in very humbly and understand that expectations and projections won't necessarily turn out to occur in ways that we expect. But there are reasons to be both optimistic and to be concerned and extra careful this season. One reason to be optimistic is that when folks are social distancing, when they're wearing masks, when they're more careful about indoor gatherings, that is expected to confer and we're hopeful that that will also confer protection against contracting the flu. So if you add vaccination, which I believe is a very essential step in protecting yourself against the flu, not only because it prevents infection, but it in particular reduces symptoms and severity of the flu if you do contract it and become symptomatic. All these are reasons to, of course, still to get the vaccine. But if you're following the public health guidance for COVID-19, the flu being a droplet-based virus for spread, you should be protected a little bit more by doing those things. All that said, you can't ignore that we're in the middle of a respiratory pandemic still that is not the flu, that is COVID-19. And the spectrum of severity of illness that we've seen with COVID-19 is very wide. Some are completely asymptomatic and still spreading it, while others have a very severe disease and, of course, succumb to it. And so you don't want to be in a position to have both at once, and that is entirely possible. As far as we know, it's completely possible because they're different viruses to be infected with both at once. And so for that reason, as a hospital, we have prepared for that possibility by stocking up even more than we did before on things like PPE, ventilators, ICU capacity, and a surge plan that accounts for the possibility of folks with severe flu, which we see every year, in addition to a potential second surge of COVID-19 in New Jersey and the Newark area. And I think every hospital CEO in conversations with the Department of Health, which has put out very helpful guidance in this state about the way we should be thinking about capacity and what the projections are for both viruses, we're all prepared for the worst, which is a surge of both at the same time. And so we are again in a situation where folks in New Jersey have been heeding in large part the public health guidelines, which should hopefully mitigate this issue. But again, because it's an environment of uncertainty and uncharted waters, if you will, we do have to prepare for a surge that is maybe the same or even worse at times during this flu season than what we experienced in the spring.
Thank you. Dr. Campagnolo, the next question is for you. How does the flu vaccine fit into the normal vaccination schedule for kids and adults, particularly those who have fallen behind? What are your concerns about the most recent stats regarding people missing their immunizations?
So the flu vaccine will fit in with just about every vaccine that is otherwise recommended for patients at certain ages. So somebody is due for measles, mumps, rubella vaccine, they can also get their flu vaccine at the well child check. Same thing for adults if they're due for a pneumonia shot, which is also very important. At the same time, we're giving a flu shot if patients are not protected from pneumonia, because pneumonia is usually one of the main complications of a severe flu infection. So again, flu shot fits in with every condition for another vaccine that we would want to give. As far as the statistics, we did see during March to May timeframe that a lot of children did not get vaccines because, of course, people were told not to go out and they weren't going to school and they weren't going to see their doctors. So we did see a drop off various levels around the country. I've seen statistics that said something between 60 to 96% decrease in vaccination rates around that time. The good thing is the other reviews I've read showed that we, over the summer, probably improved, but we're still about 30 to 35% lower than 2019 levels of vaccination. So that unfortunately leaves people who are unvaccinated open to getting those conditions, which would be things like measles, mumps, chickenpox, all of those terrible childhood diseases that we can prevent with vaccines. And again, so we can continue to bring children in now. This is a good time to do that as the schools are reopening in many places, at least part-time, to make sure that children come in for their well children check and get their flu shot, as well as pick up any vaccines that they might be missing.
Thanks. It's nice to hear that things are rebounding, even if they haven't completely gotten back to normal, but hopefully headed in a better direction. Dr. Friedland, what steps are pharmaceutical manufacturers taking to make sure that the vaccines are safe before market, either flu vaccine or any other vaccine? Are there resources that you offer patients as a manufacturer?
Thanks, Kate. Yeah, I'll address that. I also want to add one thing to what Mary was saying. In addition, adult vaccination rates have dropped dramatically from the peak of the pandemic. Data show that in the Veteran Affairs Hospital system, pneumococcal vaccination is down by 88%. Shingles vaccination has fallen by between 65 and 70%. And we want to make sure that people are protected as they head into the fall, so they're not going to the doctor's office, the ER, being hospitalized with shingles or pneumonia or pertussis. Really important that we get not only our flu vaccines, but all vaccines recommended for people of all ages. So as a vaccine researcher, I've been incredibly fortunate because I've been involved in the development of now 16 vaccines that have been used in the United States for people of all ages. And in every step along the way, from when we're developing them to when they're being given to patients, the thing that keeps me up at night always is safety. Safety is paramount. It's the most important thing that we do as a vaccine developer, because we're asking people who are healthy to be vaccinated to protect against a disease that hopefully they won't be exposed to in the future. But if they are, then they'd be protected. And so safety is absolutely critical. And when we focus in on influenza particularly, we have a tremendous history of influenza vaccination here in the United States. As mentioned last year, 160 to 170 million US people were vaccinated against influenza, and that number is multiplied all over the world. And so there is intense, continuous safety assessments with quality assurance and quality controls every step of the manufacturing way, and then through delivery and following safety surveillance. We are fortunate in the United States that we have the most robust safety evaluation program set up by various agencies within the US government. And of course, the vaccine manufacturers have in parallel their pharmacovigilance programs. And so we follow safety every step of the way. And there's lots of materials that are available for patients. First off, at GSK, just like every other vaccine manufacturer, we have a medical information department. Healthcare providers and patients can contact the medical information department to get information. The Centers for Disease Control produces the vaccine information statement sheets. When I received my flu vaccine yesterday from my local pharmacy, I was handed the VIS statement to understand about the safety profile of the vaccine. And other organizations, fantastic organizations like the National Foundation of Infectious Diseases, the Immunization Action Coalition, other groups have materials as well for families, for patients to understand the vaccine and the safety profile. So we are incredibly fortunate here in the United States that there's a robust information for families, for patients, and for providers to have for their patients. And again, just like back to where I started, safety is the most paramount thing that's part of my job and all of my colleagues, because we want to make sure that we're doing something that has a proper benefit risk ratio. And fortunately, with our experience with influenza, we have a very good system in place.
Thank you. I think that's a process that many people don't really understand on the pharmaceutical side. And so I appreciate you shedding a little bit of light into how rigorous that safety process is. And for tying back to what Dr. Campagnola said, is that there's still a significant issue in regard to adult vaccination rates. So Dr. Campagnola, I'm going to go back to you for a moment. Are there any strategies that you're employing to ensure that your patients, particularly adult patients who've fallen behind, are that you're using to make sure they're getting necessary preventative care and vaccines?
Sure, and I agree with Dr. Friedland that maybe I didn't emphasize enough that adults are also missing vaccines they should have been getting along the way. And one other thing I wanted to also mention was that apparently a couple of months ago, there was also related to the Public Readiness Act that pharmacies are also able to give children's vaccines, at least during this pandemic time. Of course, I would generally prefer that children and adults come to see their physician and do their health maintenance and other issues in their medical home. But again, we're really looking at the public health initiative right now to make sure everybody gets vaccinated. As to our own strategies in the practice, I think one thing we always try to do is what's called pre-visit planning, so that we look ahead for the patients coming in the following day when they're not a same-day appointment, and we look to see what health maintenance gaps the patients might have, so that we're ready when they come in for their appointments to get those things, that we might contact them and say, be ready to get a flu shot tomorrow or a pneumonia shot. Also, each time a clinician looks into their electronic record, there's something called the health maintenance module. So we encourage that we look at that before we go in with the patient when they are in the office, and also have been ready in our minds what other health preventive measures are needed, such as do we need to give a slip for a mammogram or set up an appointment for a colonoscopy, and again, any of the vaccines that are missing. Dr. Friedland had mentioned Shingles Vaccine, and one good thing I think that has come out of the pandemic, for the sad reason, is that people weren't coming in, and so the vaccine availability for Shingrix is much improved, where it had been waitlisted for many patients at pharmacies and practices earlier this year. So we do have much more supply of the shingles shot to give too, and catch people up on that. The other thing I think we try to do consistently is also have outreach to patients in general, for people who may not be coming in the office immediately, but looking at their gaps in care of the health maintenance, and having some staff that reaches out and calls patients during the course of the week, and just to mention that there's things that they could be doing to improve their health maintenance and preventive care, and to try to engage them in asking for those referrals, sending them out in the mail to them. We do have a couple of other initiatives, such as a drive-up flu clinic that we did for a couple of Saturdays in the past 2 months, where patients were able to drive in. We had registered them ahead of time, they got their flu shot, and they were able to drive away. So we were able to pick up a number of patients just for that purpose. And also we have what's called standing orders, so that the medical assistants in the practices, as soon as a patient comes in and they start to do their vital signs and find out what their visit is for, they will also just go ahead and give them a flu shot or a pneumonia shot if it's indicated, and those have been approved by the physicians that are in charge of those patients. So that is one way to help get the patient right away vaccinated. And then there's often people who have the vaccine hesitancy, which I think is a big issue right now, and we have to often coax some people through getting the vaccine. But I've found that the fact that the medical assistant already asked them about that when they first come in, if they are hesitant, I hear about that before I go in the room, and then many times I'm able to convert that patient into somebody who accepts a vaccine that day. So again, it's been a way of helping to reinforce our activities. And the last thing we do is we have a pediatric mobile van that actually goes into Camden and does distribute vaccines to children in Camden who might not have access otherwise. And we're staffing that with some of our virtual employees and our family medicine residents. So that's one other kind of creative way we have to help get the vaccines out there.
Thank you. I am going to ask a follow-up question if that's okay, and anyone is welcome to answer. But I know Dr. Friedland, you referenced getting your vaccine, flu vaccine at a pharmacy, and Dr. Campagnolo, you also said that children are able to get vaccinated at a pharmacy. Is there anything important as a consumer for us to know if you're getting vaccines at a pharmacy that need to be communicated back to your primary care physician?
I'll start and then I'll pass it back. In fact, today when I was out doing the flu canvassing that I mentioned, I was in a number of retail shops. I noticed at one of the pharmacies, there was a sign in the window saying we can vaccinate anybody over the age of 3 for influenza this season. The important thing for families is to make sure that if they go down that option, that information is transferred back to their primary care provider via the immunization information system that's available, and also making sure that the pharmacists communicate back to the patient's medical home. Absolutely critical. This is a public health crisis. We need to not miss any opportunities, but we also want to make sure that the information is back in the medical home so that the record is there, because that is their primary care provider.
I would definitely echo that. I think that's really my main concern when somebody gets their vaccine at the pharmacy, is just to make sure that they write their dates down of when they got it or keep their slip that they're provided, and also make sure that the pharmacist knows the primary care physician or other practice to send the information to, so we can document that. And there are ways it goes immediately into certain electronic records, should transfer pretty easily.
Absolutely.
And just to add to that, for hospitals and many healthcare institutions that require vaccinations for their employees, it's not enough just to attest that you got the vaccine at an outside location. You have to actually provide that documentation. Otherwise, we have to consider that it just didn't happen. So just an additional piece of facts there.
Thank you. I think that provides a lot of insight for those of us who are seeking vaccines in places that are not our typical provider's office. Dr. Friedland, can you tell us a little bit more about how pharmaceutical companies have been working together in light of the pandemic, and how that might affect outcomes as we go forward?
Yeah, absolutely. I mean, this is an unprecedented public health crisis, and there's so much opportunity with today's innovations and technologies to help address finding solutions based on knowledge of science and good public health practices. And so everybody is across the entire spectrum of public and private are working towards a common goal, and that's developing safe and effective vaccines and therapeutics for patients so that we can either prevent disease or treat disease when it occurs. At GSK, I'm very proud that we have a number of collaborations with a number of scientific partners, other pharmaceutical companies, in developing a COVID-19 vaccine. Our most advanced, biggest collaboration is with Sanofi Pasteur. So for those who are not aware, Sanofi Pasteur is a very large vaccine manufacturer, as is GlaxoSmithKline. And normally groups who compete are collaborating. We're working together. They have a piece of the technology with a protein subunit recombinant antigen. We have a technology with an adjuvant system that can help shape and enhance the immune response to the spike protein antigen that Sanofi is producing. And together, we're developing a vaccine. So just an example of how everybody is just trying to find out new ways to safely and effectively and efficiently help create solutions. 3 weeks ago, CEOs of 9 major vaccine pharmaceutical companies put out a pledge that together they will make sure that the scientific process is respected as vaccines are developed for COVID-19. Another example of how we're all working together for the common goal, which is the patient. That's why we're here. It's an extremely important time in our history. We have to get this right. I don't think it's a slight to say that the future of public health is on the line here. We have to get this right because there are 7 billion people on the planet who can benefit from prevention. And we just have to do it right and make sure that people understand that the scientific process is respected. And when vaccines and therapeutics become available, they're there based on benefit risk that shows there's a benefit that outweighs any risk. One other thing just to mention, you talked about this earlier, but just to reinforce about high risk, you were asking about high risk for flu. Upwards of 30% of the United States population has a high risk factor that puts them at risk for COVID-19 severe disease. Almost 100 million people in our population. So we are all at risk for this disease, either ourselves or people in our community, and we just have to make sure that we do it right. And I'm very proud that the scientific community with the public health community is working together to create solutions. And when they become available, they'll be there because they're safe and effective. That's for sure.
Thank you. I think it's very reassuring, at least to me, to hear the commitment to safety and collaboration amongst all of the pharmaceutical partners with the same goal in mind of creating a safe and effective way to really tackle this public health issue. So I appreciate that.
Absolutely.
Dr. Elnahal, can you tell us a little bit more about how your organization is working creatively to both administer the flu vaccine and get ready for the flu season this year?
Yeah, as far as the flu vaccine goes, we remain committed to administering it and guaranteeing folks to receive the vaccine here at no cost to them, our employees who work here and interface with patients every day. Normally we do this in an annual fall barbecue. We can't do that this year because of limitations on congregations. That's usually a very well attended event. We're just staggering it, making sure that folks have a scheduled time to come in and dedicated times where they can receive the vaccine, and have a very close system of tracking our progress and meeting our goal of 100% vaccination. One important detail is that we used to provide an option for folks to wear a mask if they did not get the flu vaccine. That is not an option this year, both because everyone is wearing a mask anyway as part of COVID-19 precautions, but also because the importance of being vaccinated this year really exceeds any other year in recent memory. And we were able to get that policy through and make sure that we're getting to that 100%. The only exemption that we offer is, of course, a medical exemption, an allergy or other condition to the flu vaccine, which is not very common at all.
Thanks. Well, hopefully you'll be able to get that barbecue going in years going forward. Can you also tell us a little bit more about the role of University Hospital in the COVID-19 vaccine trials?
Yeah, absolutely. And I appreciate Leonard's summary of, everything that's happening on the side of folks organizing the studies nationally and the pharmaceutical companies involved. From our standpoint, we are the primary academic medical center for Rutgers, New Jersey Medical School, which of course boasts physicians, scientists, and infectious disease that routinely do vaccine trials. In fact, we also have an ongoing HIV vaccine trial as we attend this event now. And we have done many before on HPV and other critical vaccines. We are, of course, an arm of the broader national scientific effort. We're one of 89 hospitals across the country that in particular is doing the Moderna candidate, the Moderna vaccine. I'm actually a study participant myself, as are a number of other folks in the senior team here at the hospital, both because I want to be part of the solution and be part of the urgent need to investigate these candidates, be part of the solution, but also to set an example for the community we serve, that we wouldn't be offering a trial for something as politically contested and disputed in public discourse as a COVID-19 vaccine. We wanted to make sure that we demonstrated that if we did not think the candidate had gone through a phase 1 study with favorable safety outcomes, that we would not be introducing it to the community. So that's a way for me to indicate that through my actions. It's very important to mention the very good reasons for skepticism in our community for any type of clinical investigation, not necessarily specific to vaccine trials. With the horrific history of medical experimentation in Black Americans, starting with the time of slavery, when Dr. Marion Sims was experimenting with gynecologic surgeries on enslaved women, proceeding through Henrietta Lax's story out of Johns Hopkins, and one of the institutions I trained at as a physician, who, her cells were taken from her without her permission and used for scientific research, but also eventual therapeutic applications from that cell line completely without her knowledge. And then, of course, the very infamous example of the Tuskegee study, which was literally following people with known syphilis to see if they, what the natural history of that disease was. People were lied to. People were told that, they'd be getting free health care from the federal government. And all the while, they were expressly not treated for a treatable condition, just to see what would happen, all of which is violation of every ethical standard you can think of in terms of modern clinical investigation. So we have approached this conversation with sensitivity with our community. It's a majority-minority community. And, to say what are the very important stark differences between this study and, those historical examples. And the reason that's another reason why that's coming to a head in urban communities across the country is because there's a broader conversation about how politics may be interfering with ultimate agency approvals or the science itself. What we can attest to as the academic teaching hospitals, that the science is not being politically interfered with at all. These are physician scientists that are held to academic standards. Dr. Shobha Swaminathan has a very distinguished career and a great record for running trials like this well. And we will report the results, whatever they are, and we will have our own interpretation of reasons for an eventual approval of an FDA approved vaccine for use in the broader population outside the clinical trial. We'll be making our own assessment on whether we think that was appropriate. Governor Murphy also said that there would be a process to adjudicate a decision like that as well. So, but it's important not to ignore that very important history, especially in vulnerable communities.
Well, thank you both for your personal and organizational commitment to the safety and ethics of this process. And I appreciate you explaining it in more detail to everyone, because I know that's something that's front of mind for many. I'm going to pause for a moment before we enter into our last question and just invite our attendees, if you have questions for our presenters, to go ahead and put those in the chat box, which we're monitoring. We'll spend the rest of the hour after the final question being able to address those, but I want to give you the opportunity to get those typed in. I know certainly a lot of things that you all have shared so far today have really given me hope about how we approach the next season. But I want to ask you, working in healthcare, what makes you hopeful about where we are today versus the state of the state or the world this past April and May? Do you think that your teams or organizations have shifted as a result? So I'll let you go round robin. So whoever gets off mute can go first.
Well, I'll go ahead, I guess. I think, I don't know if people out listening to us are feeling this way too, but I feel like the pandemic has really made us look at like what is really the most crucial and most important in our lives. And I think organizations have tended to look at that as well. Like, again, as far as how many meetings we really need to have, how we conduct those meetings, seems to have been a big change over the course of the past 6 months. I think, again, we had a previous webinar on telemedicine, and I think our organization has really addressed that and has done, I think, a pretty good job of being able to work with telemedicine and our patients on multiple platforms and do it fairly well, although now we're encouraging and seeing more people coming back into the practices, but we still have that option. I think we've learned how to use PPE properly and how to conserve it and recycle PPE when indicated in order to preserve our resources. And so then the other thing, I think in general, we've seen improved care of the patients who unfortunately do get COVID and need to be hospitalized. I think we're seeing better resources for them, more streamlined care and better outcomes in general on that. Still overall trying to prevent it in the long term, but people I think that are getting sick are doing better with it. And then I think just in general, we're learning more about how to streamline our office practices as a family physician. We tend to kind of, again, strip down to what's really necessary to have in each exam room, in each office, how to get the patients minimal contact with anybody else besides their treating clinicians as they come through the practice, and have a safe checkout experience as well on leaving the practice. So those would be my comments on it.
Thank you.
I'll start next, and then we'll go to Sharif. So many things come to mind for this topic. Seeing how scientific innovation and technologies are helping to create solutions within the organization, how we can rethink decision making and empowerment, giving new opportunities to our people to step up and show their, how wonderful they are, and seeing the whole scientific community come together. But I also want to say that we're seeing here, and I'm encouraged by the world recognizing the importance of prevention. We now see what the world is like when we don't have a vaccine for an infectious disease. So increased respect for that. The other side is we're seeing the politicization around this issue, which is very difficult to wrap my arms around, but here we are. But the thing I really want to leave on this topic is that I'm hopeful that our society now has a greater understanding of the importance of equity, of healthcare is something for everybody. Everybody deserves the same level of access and delivery of healthcare. And this pandemic has highlighted all the issues around social determinants of health, the increased risk among underrepresented populations. And this is unacceptable. And I'm hopeful that when we pull out of this, we will address this, because it's not equitable. And as a physician, I went into this field because I truly believe that every patient is exactly the same. And so we need to work at this, and I'm hopeful that this conversation has started, and then we'll be able to follow this. We'll have metrics so we can see what we're doing, and is it resulting in getting to a better place for everybody here in the United States.
Thank you. And I do want to, of course, echo a number of things my co-panelists said about reasons to be optimistic. I think the most important reason from the standpoint of being the steward of a hospital that really is at the tail end of people's journey with COVID-19, and as the most lagging indicator what a hospital's experience is in terms of the spread of the disease. I am very encouraged that the compliance and outward displays of responsible behavior that we're seeing from leaders across New Jersey, starting with the governor, but also Mayor Baraka, elected officials of all stripes, and important influencers in New Jersey have been very important amplifiers of the public health messaging that we need to prevent the spread of COVID-19 in the first place. So we're talking, of course, about mask wearing, hand hygiene, social distancing, avoiding gatherings. All of these things are very important, and New Jersey has really set the example. And the city of Newark also has set an example in terms of urban areas for that type of responsible behavior. And so we've seen that happen in ways that are very encouraging. Another reason to be encouraged is that we really have learned so much from our first experience with the surge in the spring. And, to the point now where we have 90 days worth of PPE, a stockpile that we've built diligently over the past several months. And in fact, that's going to be something that hospitals do across the state in preparing for whatever comes this fall and winter. And also a surge plan that has a very detailed, sort of simulated approach to what we will do to accommodate the needs of COVID-19 patients if they increase here in the hospital, but also the extent to which we can maintain our normal operations and all of the other spheres of care that we engage in for all the other care needs in the city. To the extent possible, we do want to be able to continue those other spheres of care and not have to stop and disrupt procedures and other needed services to the community. That will completely depend on what the pandemic looks like. So if we have another surge like in the spring, we're going to have to responsibly close those services. But we do want to maximize our opportunity to maintain our level of services for the community, even if we do start to see an increase. And I think we're better prepared to do that much better prepared now than we were before. And I do think my hospital colleagues across the state would agree.
Thank you all so much. I think our vision for a hopeful future is shared by many, and I hope those attendees who participated today were able to learn more about what it looks like to be safely receiving vaccines, how to do that in a way that we are promoting equity and ethics, and to be able to move forward into your own circles and spheres of influence, to be able to promote the message that vaccines are safe and necessary to keep our public health status the way it is and growing toward a healthier community. We must have been very thorough because we don't really have any questions coming in, but I'll give it a couple of moments. I do have one I wanted to ask. If people want to be spreading more information within their communities or organizations, is there a particular organization or source of information that you would recommend where they can share more about the importance of receiving a flu vaccine?
Well, I'll start on that. As I mentioned, I volunteer with the Philadelphia Department of Health through the Medical Reserve Corps, and the Department of Health has an outstanding collection of resources and opportunities to get the word out to the community and also to hear from the community. So I would say contact your local Department of Health to gather information that's local for you and your community. And the departments of health are extremely flexible in providing information that's tailored towards particular communities. So go local because that's where it really matters.
Very much agreed, and I'm biased because this was what I was doing when I was Commissioner of Health, but the materials also that are being offered by the State Department of Health are very helpful. Practical messaging, ready-made materials to spread the importance and just get the word out about the importance of getting vaccinated, myth-busting materials about what the flu vaccine risks are, etc. All of that is available on the New Jersey Department of Health's website, but also their social media efforts on Twitter and Facebook in particular. All of those resources are there for you to amplify the importance of getting a flu vaccine.
Yeah, and one other thing, and then I'll let Mary speak because this is definitely up Mary's line. The most important piece of information that helps somebody become vaccinated is their healthcare provider's recommendation. So speak to your healthcare provider, your doctor, your nurse, your pharmacist, whoever it is you get care from. That is the most important lever that results in a patient being vaccinated.
So Leonard took the words out of my mouth because that's exactly what I was going to say. I think I mentioned earlier when I have somebody who has some vaccine hesitancy or a parent who has hesitancy about their child getting a vaccine, it takes a few minutes, but often we can talk to them and convert them into somebody who will accept the vaccine, or, sometimes they'll go home and think about it and come back again. But so I think all the previously mentioned sources in the community are important, with the health department locally being crucial. But also certainly the primary care physician and their team in the medical home usually will also be getting those sources of information, as well as from some of the pharmaceutical companies that produce the vaccines, and as well as from their health systems that are local too. So I think we're all working together on trying to get the word out there.
And I would add that there's not only misinformation about vaccines, but there's also disinformation from parties that, have whatever incentive to, unfortunately, reduce confidence in vaccines, including foreign actors, by the way, on social media, who are sort of disrupting society here. Part of their set of goals is to increase vaccine hesitancy in the U.S. And I will just double down on what Leonard said. The best way to fight disinformation is to have a trusted provider who have already spent the time and effort to gain the trust of their patients, communicate the truth, and communicate what the risks and benefits are of any type of vaccine to their patients. And for almost every vaccine, that profile is overwhelmingly on the side of getting the vaccine. What I'll also say is that we have to be prepared to face an overwhelmingly hesitant sentiment on a COVID-19 vaccine, even if one is approved with a very favorable efficacy and safety profile. There's already just in a generic questioning in polls, almost half the country saying that they would not get the vaccine, even if it is FDA approved, whatever that vaccine or set of vaccines may be. And our workforce, our frontline physicians and providers who patients trust, will be the most important allies we have in ultimately getting folks vaccinated for COVID-19, in addition to the flu.
Well, thank you all so much for your time today. We appreciate your expertise, your willingness to share, and your hopeful outlook for the future. I'll have Virginia put up our last slide so that I can share the next Quality Institute event that we're bringing to you, all of our members. And then I hope you have an excellent rest of your day. On October 14th, we are going to be hosting another webinar entitled Health Insurance Coverage and the New State-Based Exchange, in anticipation of the state-based exchange opening November 1st for the open enrollment period. We have a number of excellent speakers, and we hope you all will stay tuned to that. You can either follow this link or you can go directly to our website and register there. Again, thank you to Drs. Campagnolo, Friedland, and Elnahal. We appreciate your expertise today, and for the many members we had join us, thank you again. I hope you have a great rest of your day.
Thank you.
Thank you, everybody. Bye.
Well, thank you, Kate.
Thank you. We appreciate everything.
Nice job.
Thank you so much.
Yeah,
We've already gotten great feedback. It was wonderful.
Yes,
Good.
we appreciate
Plethora of
it.
information.
And no technology mishaps, so nice work.
All right. Have a great day, everybody. And thanks for including us.
Thank you.
Thank you.
Bye.
Bye.